Aged Care Royal Commission. 148 recommendations in total, 8 volumes. Effectively, the most stark finding is that 1 in 3 senior Australians receiving substandard care. Let's go through some of these other key points. The Royal Commission recommending a new Aged Care Act, calls for an Aged Care Commission to be established, an Inspector General of Aged Care as well, regulating the use of restrictive practices in aged care, that it should be prohibited except in some specific circumstances, improve the design of aged care accommodation, reduce or clear the home care package waiting list, which currently stands at 100,000. The government should develop and publish a system of star ratings to enable people to compare aged care providers, and new standards for staffing, including minimum training requirements. Let's bring in our political editor, Andrew Clennell, who was at Kirribilli House for this release. Andrew, your questions basically went to the point that the Royal Commissioners and the government at this point are finding it hard to put a total number on how much this is going to cost, but it's going to cost billions and billions of dollars.
Well, that's right. And Scott Morrison just earlier, he didn't rule out as much as $20 billion a year, did he? He wouldn't call it outlandish. But, Kieran, it is quite a shocking report when you think about elderly people in our society. The suggestion that 1 in 3 get substandard care in this report, that 13 to 18% are subjected to assaults. And I put it to the Prime Minister, isn't this a national disgrace? This report says that 1 in 3 Australians in residential aged care have substandard facilities. It says that 13 to 18% of people in aged care have been assaulted. And it says the current aged care system and its weak and ineffective regulatory arrangements did not arise by accident. The move to ritualistic regulation was a natural consequence of the government's desire to restrain expenditure in aged care. In essence, having not provided enough funding for good quality care, the regulatory arrangements could only pay lip service to the requirement that the care that was provided was of high quality. Now, you've been Prime Minister and Treasurer for 5 years or so. Do you agree this is a national disgrace, and do you accept any share of responsibility over that?
Of course I do, Andrew. I've been Prime Minister for over 2 years, and prior to that I was Treasurer for 3. I've been in this cabinet since we were first elected. And so our government will take our share of the responsibility, like all governments over the last 25 to 30 years, which is what the Royal Commission, that very quote that you've just referred to, was referring to governments over the last 25 years. That has been the prism, the framework in which our aged care sector has been funded and run. And while as well-intentioned as everybody who may have served in governments, in cabinets or in policy advice systems, or run health aged care facilities, or provided support in whatever way they could, despite those best intentions, those are the outcomes, Andrew. That's why I asked the question, because I could not get the assurance that the answer would be any different to that. And so I honestly asked the question. You now have the answer. I now have the answer. And the roadmap that it sets out to dealing with that fundamentally seeks a shift from a constrained system that focuses on funding to providers to a needs-based system that puts the person at the centre.
The Prime Minister earlier there at Kirribilli House with Andrew Clennell. And Andrew, the question is then, what are the options? What are the options for paying for all this? Is it an increase in the Medicare levy? Will people have to use their homes? How are they going to come up with that roughly $20 billion or so a year?
Well, it sounds like potentially both, Kieran, doesn't it? I mean, he didn't rule anything out. I thought his comment on the levy was quite interesting, because he said he'd previously, as Treasurer, moved for a slight increase in the Medicare levy and it got blocked. But at the same time, he's saying he's got to work out how much of this has to be user pays and how much for the taxpayer. But that report so expresses, as I said in that question, about the fact that governments have looked for that fiscal restraint is what has got us in the situation they were in. Also surprising to me that after 2 years of a Royal Commission, Kieran, we can't establish exactly how much funding is needed. I mean, how does one establish that then? Let's have a listen to me ask the PM about costs and then him not rule out an aged care levy as part of this budget deliberations. How much money is required?
The answer to that question is not known at this point, Andrew. And the Royal Commission doesn't know what the answer is yet. And what the Royal Commission has found is that is an assessment that has never been undertaken based on a needs-based model. We'll consider those things. You know our government's disposition when it comes to increased levies and taxes. It's not something that we lean into. In fact, as Treasurer, I once sought to increase the Medicare levy by 0.5% to provide support to the National Disability Insurance Scheme, and I wasn't supported in that by the Labor Party or the Greens for that matter. So that's something that I've seen in other contexts that the Parliament hasn't supported before. So you'd forgive me for being a little wary at this point.